This is a sagittal section through the head and neck with the nasal septum being obvious here. Okay, so let's talk about the structures that we can see. This is all the nasal cartilage. We've got three parts of it. This is the alar cartilage or the lower lateral cartilage. This is the epilateral cartilage, and this is the septal cartilage. This is the nasal septum. It's formed majorly by three structures: perpendicular plate of the ethmoid, vomer, and the septal cartilage. It is also formed minorly by small parts of the surrounding bones. For example, the palatine process of the maxilla, the horizontal plate of the palatine, the sphenoid, ethmoid, frontal, and also nasal bones. This is the frontal air sinus, supplied by the supratrochlear and supraorbital nerves, which are branches from the frontal nerve, which is one of the branches of the ophthalmic division of the trigeminal nerve. And this is the sphenoidal air sinus. Here we can see the pituitary gland or hypophysis in the hypophyseal fossa or the sella turcica. This is the internal carotid artery. It will give off a small branch which passes through the optic canal, which is called the ophthalmic artery, but it's really not very obvious here. This is the optic nerve, which is the second cranial nerve. Here we can see the trigeminal sensory ganglion. From here we've got three divisions. The ophthalmic division, which gives off lacrimal, nasociliary, and frontal nerves passing through the superior orbital fissure, if you can see that. And then this is the maxillary division passing through the foramen rotundum, and finally the mandibular division passing through the foramen ovale. This is the internal acoustic meatus, and these are the facial and vestibulocochlear nerves passing through. This is the jugular foramen for passage of the glossopharyngeal, vagus, and accessory nerves. And this is the hypoglossal nerve passing through the hypoglossal canal. This is of course the spinal cord. Okay, and this could be the vertebral artery. In the pterygopalatine fossa, we've got the pterygopalatine parasympathetic ganglion. From the ganglion, we've got the greater and lesser palatine nerves passing through the greater and lesser palatine foramina. We have the nasopalatine nerve, which goes on the nasal septum to the incisive canal and incisive foramen. And we also have a pharyngeal branch to the pharynx, and we also have nasal branches which divide into medial and lateral branches. They go to the lateral walls of the nasal cavity, like that. Okay, these are the lateral walls. We also have the palatal branch from the facial artery, and also terminal branches from the descending palatine artery, which is a branch from the maxillary artery, to pass through the incisive foramen canal. This is another sagittal section through the head and neck. but this is a deeper dissection. So the nasal septum has been removed so that we can see the lateral wall of the nasal cavity. Here we can see the superior, middle, and inferior conchae. The superior and middle conchae are not regarded as separate bones, but they are parts from the ethmoid bone. However, the inferior conchae are regarded as separate bones. Below each concha we've got meatus, so this is the superior, middle, and inferior meati, and this is the sphenoethmoidal recess. We have got openings in each of these spaces. In the sphenoethmoidal recess we've got opening for the sphenoidal air sinus. In the superior meatus we've got opening for the posterior ethmoidal air sinuses. In the middle meatus we've got openings for the frontal air sinuses, anterior and middle ethmoidal air sinuses, and also maxillary air sinuses. In the inferior meatus we've got opening for the nasolacrimal duct. The lateral wall, or basically the nasal cavity, is lined with mucous membrane, except for this small area which is called the nasal vestibule. This is not lined by mucous membrane, but it is lined by skin and hairs. And of course this is the nostril. Okay, this is the nostril of the nose. This is a sagittal section through the head and neck, where the conchae have been removed so that we can see deeper structures. Okay, so this is the sphenoethmoidal recess, as we said, for opening of the sphenoidal sinus. Here we can see the olfactory nerves or olfactory fibers, which will lead to the olfactory bulb on the cribriform plates of the ethmoid, and then the olfactory tract. Here this is the superior meatus. This is the superior concha, the middle concha, and the inferior concha. So we have inferior, middle, and superior meati. The superior meatus for posterior ethmoidal air sinuses. In the middle meatus we've got some structures. This line is called the hiatus semilunaris. Hiatus semilunaris. It will lead to the infundibulum, and here we can see the bulla ethmoidalis. The bulla ethmoidalis is formed by the middle ethmoidal air sinuses, so it will also contain opening for middle ethmoidal air sinuses. In the hiatus semilunaris we've got opening for the maxillary air sinus, and in the infundibulum you've got opening for the frontal air sinus and also anterior ethmoidal air sinuses. And again here in the inferior meatus we've got opening for the nasolacrimal duct. Again, this is the nasal vestibule, which is not lined with mucosa, but it's covered with skin and hair. Talking about some of the structures that we can see through layers of the head. So here in the first layer we can see some structures. These are the bones. This is the frontal bone and the parietal bones. This is the superior sagittal sinus. These are the cerebral hemispheres to the right side and to the left side. This is the gray matter and the white matter. Okay, and by the way here these are the internal and external tables, and this is the diploby, which is composed of cancellous or spongy bone. This is the suture. Okay, so and these are layers of the scalp. Now covering the brain is meninges. It is composed of dura mater, arachnoid, and pia mater. The dura mater forms the falx cerebri, so this is the falx cerebri, like that. These are the coronal sutures between the frontal and parietal bones, and this is the sagittal suture. In the second layer, we can see belly of the temporalis muscle, and here we can see the superficial temporal artery and vein. In the third layer, we can see the occipital bone. So these are the lambdoid sutures, and again the parietal bones and frontal bone. In the fourth layer, we can see the frontal or sinuses. In the fifth layer, again we can see the frontal or sinuses. This could be belly of the frontalis. Okay, it shouldn't be merged with the temporalis muscle. In the sixth layer, again, these are the frontal or sinuses. This is the orbital cavity. These are the internal carotid arteries and the optic chiasma. In the seventh layer, again, we've got the orbital cavities. This is the nasal septum. These are the ethmoidal or sinuses divided into anterior, middle, and posterior groups. These are the sphenoidal or sinuses. This is the medial and lateral rectus muscles. This is the optic nerve. In the eighth layer, we can see the transverse sinuses. In the ninth layer, we can see the ethmoidal or sinuses, the maxillary or sinuses, the sphenoidal or sinuses, the nasal septum. In the 10th layer, we can see the temporomandibular joints here, temporomandibular joints, and this is ramus of the mandible. So this is the medial pterygoid and masseter muscles. This is lateral pterygoid muscle. In the 11th layer, again, we can see the lateral pterygoid muscles, the lateral pterygoid muscle, and this is part of the mandible.